Healthcare finance is a complex and integral aspect of the modern healthcare system. It encompasses the management of financial resources within healthcare organizations, the funding and delivery of healthcare services, insurance mechanisms, and the economics of healthcare provision. Understanding healthcare finance is crucial for healthcare professionals, policymakers, patients, and anyone involved in the healthcare ecosystem. This article explores the intricacies of healthcare finance, its challenges, and potential solutions. The structure of healthcare finance. Healthcare finance involves various stakeholders, including healthcare providers, insurers, patients, and government agencies. At its core, healthcare finance revolves around the allocation and utilization of financial resources to provide quality care while managing costs effectively. Healthcare providers. Healthcare providers encompass hospitals, clinics, physician practices, and other entities involved in delivering medical services. They face significant financial challenges, including rising operational costs, technological advancements, and regulatory requirements. Healthcare providers must manage revenue streams, control expenses, and optimize resource allocation to maintain financial stability while delivering quality care. Health insurance. Health insurance plays a vital role in healthcare finance by spreading financial risk across a pool of insured individuals. Insurers collect premiums from policyholders and use these funds to cover healthcare expenses, including medical treatments, medications, and preventive care. The dynamics of health insurance involve complex actuarial calculations, risk assessment, and underwriting processes to ensure financial viability and affordability for policyholders. Government programs. Government-sponsored healthcare programs, such as Medicare and Medicaid in the United States, play a crucial role in financing healthcare for specific populations, including the elderly, low-income individuals, and people with disabilities. These programs rely on government funding, taxpayer contributions, and regulatory mechanisms to provide essential healthcare services and support vulnerable populations. Challenges in healthcare finance. The healthcare finance landscape faces numerous challenges that impact both providers and patients. Cost of care. The cost of healthcare continues to rise globally, driven by factors such as technological advancements, aging populations, chronic disease prevalence, and administrative expenses. Rising healthcare costs strain healthcare budgets, challenge affordability, and contribute to disparities in access to care. Regulatory compliance. Healthcare organizations must navigate complex regulatory frameworks governing billing practices, coding standards, fraud prevention, and healthcare data privacy. Non-compliance with regulations can result in financial penalties, legal liabilities, and reputational damage. Healthcare inequities. Healthcare finance intersects with social determinants of health, contributing to disparities in healthcare access, quality, and outcomes. Socioeconomic factors, geographic location, race, ethnicity, and insurance coverage influence individuals' ability to access and afford healthcare services. Solutions and innovations. Addressing the challenges in healthcare finance requires collaborative efforts among stakeholders and innovative approaches. Value-based care. Shifting from fee-for-service models to value-based care emphasizes quality, outcomes, and cost-effectiveness. Value-based care incentivizes providers to deliver high-quality care efficiently while focusing on patient-centered outcomes and population health management. Health information technology. Healthcare organizations leverage technology, electronic health records (IHRs), data analytics, and telehealth solutions to streamline operations, improve care coordination, and enhance financial performance. Health information technology facilitates data-driven decision-making, interoperability, and patient engagement. Payment reform initiatives. Policymakers and payers explore payment reform initiatives, such as bundled payments, accountable care organizations, ACOs, and alternative payment models, APMs, to align financial incentives with care quality and outcomes. Payment reform encourages care integration, care management, and cost containment strategies. Addressing social determinants of health. Healthcare stakeholders recognize the importance of addressing social determinants of health, such as housing instability, food insecurity, education, and employment, to improve health outcomes and reduce healthcare costs. Healthcare finance is the management of financial resources in the healthcare industry. It is a critical aspect of the healthcare system that ensures the delivery of quality healthcare services to patients. Healthcare finance involves the planning, organizing, directing, and controlling of financial resources in healthcare organizations, including hospitals, clinics, and other healthcare facilities. There are various models of healthcare financing, including fee-for-service, capitation, global budgeting, and value-based payment. In the fee-for-service model, healthcare providers are paid for each service they provide to patients. Capitation, on the other hand, involves a fixed payment per patient, regardless of the services provided. Global budgeting is a payment model where healthcare organizations receive a fixed amount of money to cover all healthcare services for a specific period. Value-based payment is a model that rewards healthcare providers for delivering high-quality care. The sources of healthcare financing include private health insurance, government-funded programs, and out-of-pocket payments. Private health insurance is provided by private companies and is usually obtained through employers or purchased individually. Government-funded programs, such as Medicare and Medicaid, provide healthcare coverage to specific groups of people, such as the elderly and low-income individuals. Out-of-pocket payments refer to the direct payments made by patients for healthcare services. However, healthcare finance faces several challenges that impact the delivery of healthcare services. One of the major challenges is the rising healthcare costs, which make it difficult for patients to access affordable healthcare services. Inadequate funding is also a significant challenge, especially for government-funded programs, which often struggle to cover the increasing costs of healthcare. Fraud and abuse in the healthcare system also contribute to the financial burden, as they result in unnecessary costs. Technological advancements in the healthcare industry also pose a challenge, as they require significant investments in equipment and infrastructure. To effectively manage healthcare finance, healthcare organizations employ various strategies, including cost containment, revenue cycle management, budgeting and financial planning, and risk management. Cost containment involves reducing unnecessary costs and improving efficiency in healthcare operations. Revenue cycle management focuses on optimizing the revenue cycle to ensure timely and accurate payments. Budgeting and financial planning help healthcare organizations to allocate resources effectively and plan for future financial needs. Risk management involves identifying and managing potential financial risks, such as fraud and abuse. The management of healthcare finance has a significant impact on patients. Effective healthcare finance management ensures that patients have access to quality healthcare services. It also helps to keep healthcare costs affordable for patients, making it easier for them to seek medical care when needed. Additionally, proper management of healthcare finance can improve the quality of care provided to patients, as healthcare organizations can invest in new technologies and resources to enhance patient care. In conclusion, healthcare finance is a crucial aspect of the healthcare industry that plays a significant role in ensuring the delivery of quality healthcare services to patients. It involves the management of financial resources in healthcare organizations and is essential for the sustainability of the healthcare system. Effective healthcare finance management is crucial for the accessibility, affordability, and quality of healthcare services. Thank you for joining us on this financial journey. We hope today's insights have added value to your financial literacy. Remember, financial success is a journey, not a destination. If you enjoyed today's content, don't forget to hit the like button, share with your friends, and subscribe for more insightful videos.